So I will start and ask you obviously like the most important question. If you could please introduce yourself and tell us what got you into this field of work.
Oh, okay. Hi, I'm Ed Bullmore. I'm a professor of psychiatry at the University of Cambridge. I've been interested in mental health for a long time. Um, I think what got me interested to begin with was uh, feeling that we didn't really understand where mental health disorders came from very clearly,
Yeah.
and that opened up sort of opportunities for mental health disorders to be not very humanely treated always, let's say. Um, so that's what got me interested in the first place, was thinking we're at a point maybe in science, in medicine, where we can begin to think a bit differently about mental health disorders, and that will lead us to a better way of treating or preventing them.
Great, amazing. So for the people who don't know yet, could you just give us a few information about your background? If you're a teacher in psychology, a professor, if you're a psychiatrist, just for the people.
Yes, of course. So I'm a psychiatrist, which means that because sometimes people are not always sure what the difference between a psychologist and a psychiatrist is.
Yeah.
So to be a psychiatrist, as you know, you have to be a doctor, and then you specialize in mental health disorders. Whereas to be a psychologist, you don't have to be a doctor. You can specialize in psychology and then focus on clinical psychology in particular. So there are two quite different ways of doing things, but they're basically one's a doctor, one's not.
Okay.
The psychiatrists, because they're the doctors, that gives them the prescribing power. So they tend to take a more drug-based approach
Okay.
to mental health.
Mm-hmm.
And also doctors have the sectioning powers, the powers under the Mental Health Act,
Okay.
where people can be detained for treatment if
Okay.
they're considered to be a risk to themselves or to others.
Mm-hmm.
So that aspect of severe mental illness is more kind of in the hands of the psychiatrists. And
Okay.
the psychologists are more focused on, cognitive behavioral therapy,
Mm-hmm.
psychoanalysis, other interventions that can be very effective but don't involve drugs.
All right. Great. Thank you very much for this clarification. So there is a lot of mental illnesses today, but
Yeah.
first I would like to talk about depression, which seems
Yeah.
to be one of the most common. And I know
Uh-huh.
that's something that you've studied quite a lot. So I want to know, according to you and your studies, what causes depression? I saw you mentioned in some of your articles and books like inflammation, which was a
Yes.
surprise to me, but I would love to hear more about that.
Thank you. Um, well, the first thing I'd say is that depression is very, very common. So, I think almost everybody will have some experience of depressive symptoms. Major depressive disorder is, really applies to people that have those symptoms for a long, long time in some combination, and also, causing them some functional disability. They're not able to do the things they'd normally do because of those symptoms. That's what we think of as kind of clinical depression. But I
Yes.
think all of us have experience of depressive symptoms. I mean, I know I do.
Mm-hmm.
And I think that they come from multiple different causes. I don't think we should be thinking there's one cause of depression,
Mm-hmm.
any more than there's not one cause of obesity or, um, you know, uh, there are many ways in which we differ. Um, there are many kind of many of our current mental health diagnoses
Mm-hmm.
are not very specific about cause.
Yes, and that's
You
why I
know,
would love to know more. So is it
that's right.
because there's just more than one cause, so we cannot pinpoint what is the exact cause, or is it that we haven't studied that in depth yet? How
Yes.
come we cannot pinpoint like this
Okay.
is because of your environment, or this is maybe
Right.
hereditary? Why can't we know that?
Well, I think the short answer is we need to do more research. But the way I think of depression a little bit like in the old days, we would have talked about somebody having a fever.
Mm-hmm.
So somebody's got a fever. Well, 100 or 50 years ago, everybody with a fever got the same treatment. Then we figured out medicine figured out that you could have a fever for many different causes, many different infections, and for each different infection, you could have a different antibiotic. And then you've got a real, that was the big, big breakthrough in medicine and I'd like to think that something similar is going to happen with depression.
Yeah.
You know, that we're going to stop treating it as if it was just one thing. Everybody gets the same antidepressants or the same CBT, and we try and figure out what are the causes that are contributing to depression, and can we do something more specific about the causes?
Yeah. All right.
And
So
inflammation, just to pick up on that, because you mentioned it, I mean, you said it was a bit surprising to you, and I think it was
yes, it was.
surprising to me, to be honest, as well, when I first heard about it. It didn't make sense to me because I've been brought up, you know, educated to believe that the immune system, which is where inflammation comes from,
Mm-hmm.
and the brain, where you had nothing to do with each other. So, you know, I couldn't really understand how inflammation could cause depression. But all I'll say briefly is that this is an area where the science is changing very, very fast. And, you know, what we thought we knew about how the immune system and the brain interact is, you know,
We'll
pitiful
only touch the
incomplete,
scratch.
you know, because what's really going on there is a much more in-depth interaction. So I wouldn't say that, you know, we've kind of clinched it yet
Mm-hmm.
for, you know, inflammation and depression, but I see there's going to be a lot of interest in the immune system in mental health disorders generally, as there is in dementia and neurodegenerative disease. You know, a lot of brain diseases
Are caused
tend
by
to have an
inflammation.
immune or inflammatory component. So
Mm.
I think that's going to be ever more important.
So in that case, the real question is how do we strengthen our immune system then?
Yes. And of course, that's easier, you know, it's often easier said than done. Um, Obesity actually is one cause of mild inflammation, and we know that obesity and depression tend to go together, and maybe, you know, inflammation is part of that.
Mm-hmm.
Um, so you know, you could recommend, you know, it's interesting to see, you know, with these new weight loss drugs coming through,
Yeah.
and people losing weight. I think we're seeing some evidence of psychological benefits as well
Mm.
as a result of that treatment. And, you know, that could reflect the fact that less obesity, less inflammation,
Mm.
and for some individuals that could mean less depression.
Oh,
Uh,
interesting.
so these are just sort of, you know, um, suggestions. I mean, the other thing that I think briefly is worth mentioning is that, you know, when so one thing we do know about mental health disorders is that, you know, if you are exposed to adverse social experiences in early childhood,
Mhm.
that can have a lasting
Interesting.
impact on your risk for later mental health disorders. You know, if you're, you know, deprived as a child or traumatized as a child, that has a very negative effect on long-term risk for mental health. And I think that turns out to be a place where the immune system might also be playing a part somehow. But, you know, when you are, particularly as a child, when you're exposed to a threat to your survival, like an infection or a very adverse social environment, there's quite a strong immune response to that.
Mm.
Maybe that has a long-term effect on brain development. These are some of the sort of ideas that I think are in circulation at the moment, but
That's really interesting to see how actually autoimmune system is related to depression. Now I have another question. Often when I try to read or to learn a bit more about mental health issues, I see that depression, anxiety, and sometimes also bipolar disorder or
mhm,
OCD seems to
mhm,
be correlated somehow. Why?
yeah,
Because to me, anxiety and depression is different. Bipolar and depression is different. So how come
yeah.
they seem to be linked?
Well, that's a good question. I think I think it boils down to how, you know, where those diagnoses come from in the
Mm.
first place. You know, major depressive disorder, generalized anxiety disorder, bipolar disorder, obsessive compulsive. You know, they're basically designed by a committee
Mhm.
of psychiatrists.
Okay.
Um, and like we were saying about the depression,
Mm-hmm.
they never really would, they never really, those diagnoses were never really based on understanding the cause of the symptoms.
Mm.
Okay, they were just like sort of, I don't know, descriptive,
Yeah.
clinical descriptions. Um, and I think what we're finding as we get more and more insight, let's say into the genetics of mental health disorders,
Mm.
is that the genetic risk factors aren't unique to the different, diagnostic syndromes.
Okay.
It's not like the genes for schizophrenia
Mm-hmm.
um, are only sort of involved in the risk for schizophrenia as it's clinically diagnosed. They also contribute to the risk for bipolar disorder
Oh.
as it's diagnosed. So I think what it's saying, it's kind of, they're not, if just going back to what you were saying, that you think of depression, anxiety, bipolar disorder, and obsessive compulsive disorder as separate things.
Mm-hmm.
To me, that would mean they had distinct and separate causes.
Ah,
You know what I mean?
and maybe they don't.
And maybe they don't, because we don't really know
Mm,
yet.
yeah, that's interesting. So one more question, which I know may be a bit, for lack of better word, depressing, but it's a question I'm really wondering. Can we really cure a mental health illness? Or let's say when someone has schizophrenia or if someone is bipolar, then they're like this and they just have to learn to live with it? Or can it be possible that after a few years, someone is done with schizophrenia, done with dementia, or whatever mental
Mm,
health illness that they may have?
mm. Well, I think I'm not sure about the word cure, but
Mm,
I do think we could be much more ambitious about prevention.
okay.
Yeah. Uh, because, if you think about somebody with schizophrenia, let's say,
Yeah.
it's not like that everything's perfectly okay, and then one day they suddenly, they become schizophrenic, and then
Time.
they're schizophrenic forever. It's not, there's usually a sort of gradual build up.
Mm,
You know, people become a little bit more detached from their family, or they lose interest in school or work or whatever, a bit of
yeah.
disengagement. People hear voices. It's not too clear what's going on. It takes quite a long time for somebody to kind of develop the sort of long-term disabling disorder that we all know and fear as
Mm,
schizophrenia. And I think, what I'd like to see is us being more effective in sort of stopping that from happening,
yeah.
because there is plenty of warning time, actually. It's like typically this process happens over several years.
Yeah.
Um, and even after somebody's had one, as you know, with schizophrenia, bipolar disorder, the way a lot of patients tend to kind of cycle through, you know, they 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 have a flare up, they go into hospital,
Mm-hmm.
they get medicated,
Yeah.
symptoms calm down, they leave hospital.
And they feel
Often they stop taking the medication because they don't like the side effects, which can be severe. Symptoms tend to flare up. So a lot of patients are on that cycle.
happened.
And
Yeah.
I think we need to stop that, break that cycle somehow, and find more effective ways of helping people sustain recovery.
Mm,
Um, which I would think of as sort of prevention. You're just trying to prevent the worst, because there's no need. I think that we could see much better outcomes if we were more thoughtful about how to prevent,
yeah.
further relapse.
So what could we do to prevent?
Um, well, there are things that, we could think about. Um, it depends how far back you want to go in the sort of history of things. But, one risk factor we know for schizophrenia and a lot of other mental health disorders, that we touched on this already, is childhood adversity. So particularly early life infections have a significant effect on later risk of schizophrenia. It's not the sole cause of schizophrenia, but it's another
Yeah.
thing that puts a child at risk, particularly if they've got a certain genetic background.
Mm-hmm.
Um, so anything that improved the health and welfare of mothers and young children in the sort of pregnancy, early stages of life,
Yeah.
what some people call the first 1,000 days.
Mm-hmm.
So all the focus that we see politically now on child poverty
Yeah.
and all of that, that is actually investing in children of that age, I think, is a long-term benefit in terms of prevention of later mental health disorders,
Mm.
including schizophrenia. So that would be one thing that we could do.
Yeah.
Hopefully we are going to do.
Mm-hmm. So this is if we focus on very young children, but what about teenagers or young adult? Is it too late or could we still
No,
do
no,
something to
it's
prevent?
definitely not too late. No, no. Um, I think, the sort of science wonk wants to say we need to really understand the mechanism. We need to understand why people continue to get worse.
Yeah.
And then once we know that, then we can design some kind of very precise
Mm.
way of preventing the illness. But I think there's much more we can do. I mean, I think this is much, much worse in the States, to be honest, from
Okay.
what I hear, by the way. The sort of, I don't think there's very much focus on trying to prevent
Mm. Okay.
people from getting worse. I think the system is geared to remunerate treatment of a current crisis.
Instead of
And
prevent.
that's what the health insurance companies will pay for. They don't seem to kind of regard it as a sort of reimbursable expense to think about prevention. But the only other thing I say about prevention, it's also kind of like part of the government. It sort of fits with this thing we were talking about, child
Mm-hmm.
health, child poverty. It's sort of one of the Wes treating kind of priorities for the NHS, as you probably know, is to shift from kind of like hospital to community and from
Yes.
intervention to prevention.
Mm-hmm.
And I think this kind of trying to think, not so much just going back to your question, will we ever be able to cure these disorders, but can we prevent them? I feel much more optimistic about that. And I think it's much more aligned with, how you can imagine the health service evolving, how you can imagine the science
Yeah. Yeah.
evolving.
Mm. That's very, very interesting. Then, from what I've seen, there's a rise in mental health issues, maybe not as severe as schizophrenia, but depression and anxiety seems to be more and more common, especially in
Mhm.
younger demographics. Do you have an
Mhm.
idea why? And do you think that our um, modern lifestyle has a role to play in it?
Mm. I think these are very difficult questions, and again, they come back to this question of fundamentally diagnosis.
Mm,
Are we always getting the diagnosis right?
yeah.
Um, and I think there's a lot of uncertainty about that. Again, the government has recently questioned whether there's overdiagnosis in some areas.
So this, yeah.
Yeah. Um, and I don't want to reiterate the conversation we've already had, but I mean the diagnostic system in psychiatry is weak
Mm,
because it doesn't understand cause.
mm,
It just it's just descriptive. So that makes it difficult to be sure whether the increase that we see is real or it represents some change in diagnostic
uh,
standard, what it takes to be diagnosed as having
mhm,
adult ADHD or autistic spectrum disorder or depression or anxiety or
mm,
dyslexia. There's increases in all of these
yeah.
uh, areas, eating disorders.
Mm,
You know, I don't think personally it's just that. I don't personally think it's a diagnostic shift. I think it is probably signaling that there's something. Um, I think it's signaling that there's likely something toxic for the
for the brain.
development of mental health.
Mm,
Um, that the current generation is being exposed to. I mean, it could be, there are a lot of that. I think there are a lot of risk factors that look a lot sort of gnarlier to me
Mhm.
that young people are encountering now compared to, what it was like, when I was growing up, for example, I think.
Mm.
Um, but I mean, it certainly is a big shift. I think, I also think COVID is still with us in some ways. I think the social atomization
Mm.
of COVID, particularly as it impacted on students and young people, was pretty catastrophic. I think that's likely to be contributory, in recent years. Um,
Do we have some research or do you have some figure or maybe some insight to share with us on the impact of isolation on the brain and on mental health? Because we did spend a lot
yeah,
of time isolated. So could there
yeah,
be some long-term
we did.
impact?
That's quite right. Um, I don't have a good answer to that, to be honest. It's a very good question. I know that when COVID first hit, um, a group of people, including Simon Wesley, who I don't know if you've heard about him or
No.
talked to him. Um, anyway, they wrote a review in the Lancet about the psychological impact of social isolation.
Mhm.
But that was at the start of COVID. That was based on what we knew then.
Ah,
I'm not aware of what
now we
more we've learned since then.
yeah.
But anecdotally, I would say, in terms of, my children who were kind of like in their 20s and going through education at the time, or my experience, in the university, seeing the impact on students and talking to colleagues, I'd say it had a massive effect
Mm,
on all aspects, really, of young people's lives, particularly.
yeah.
Um,
So what could we do? Is there any practical advice or practical activities that we can do to take care of our brain? So we could maybe to prevent or just to ensure that we are in a great mental health state. Is there, for example, for our body, we do some fitness, we go and run.
yes,
What can we do for our brain to make sure that is
yes,
in a good health?
yes. Well, I would say I would begin by challenging the idea that you do some things for your bodily health and some things for your brain health.
Okay.
Just, I would say think of the brain as part of the body.
Ah, together, just one.
Yes.
Interesting. Yeah.
So most things that you do that are good for your body will be good for your brain.
Ah, interesting.
Yeah.
Great.
There might be things that are good for your brain, like reading, that
Mhm.
aren't necessarily so good for your body. But
Point. Mm.
I think I mean, particularly as you get older,
Mhm.
um, you know, I think very, very important to stay mobile, you know,
Keep it moving,
keep it
walking,
moving
running.
always.
Mm.
That's probably the single most important thing.
Yeah,
Keep move about a bit from time to time, at least.
great.
Um,
Well, thank you very much, Ed. I don't know if there is a special message that you would like to share, or if there is yeah, a particular point that you would like to expand on. But for this
no,
last
no,
minute, the
no,
floor
no.
is
I've really enjoyed the conversation,
thank you.
Candice. I wish you all the best of luck in the competition. And
Thank you.
thanks for speaking up about mental health.
It's such an
Very
important
important.
topic. It's such an
Yeah.
important topic.